So, welcome, Will, to the spiritual psychologist. So excited for this conversation. I feel like you are the daddy, the daddy of neuroplasticity, polyvagal theory, and all things nervous system regulation. That's how I see you. So, when I was thinking of guests to have on this podcast, I was like, I've got to get Will on. And I feel like this is just going to be such a great conversation to have to widen our knowledge and to support our listeners and viewers to understand this at a deeper level.
I do want to say a big thank you just for opening up this conversation. And I'm sure this is going to help a lot of people to understand deeper the nervous system, because that's kind of my job, is to not just gloss over like, okay, so you want to regulate your nervous system, but my job is to like explain why, how,
Yes.
what's going on. What are these different expressions of nervous system dysregulation that you can notice? And sometimes they're very subtle. It's just like this generalized discontent. And you're like, I just don't feel like I'm living my full potential.
Yes. Yes.
And then people are like, well, that's just normal. But no, that's a type of subtle or just background dysregulation. And that also can be healed.
Yes. And it's also that thing of like the buildup of it. Like if you're feeling like that, if you've got that feeling when you're like, I don't know, 18, right? It might be a kind of like, all right, I'll pass. If you still have that feeling at 42,
Mhm.
then to me, that's like, okay, whatever age it's at, it doesn't matter. But you could be carrying that feeling for the whole of your life, and there's a um, path forward from it, isn't there? I guess I was thinking about where to start with this conversation, and it would just be so helpful to maybe think about how do we know when we are functioning from a dysregulated nervous system state of being. So I guess it can show up in so many different ways. Maybe you could talk about some of the more obvious ways, but also some of those more subtle indicators.
Yeah, I'd love to do that, because I feel like that's one of the first places I usually start with people. We need to know the roadmap so we can know what's kind of happening. And uh, you hear a lot about people saying, okay, well, there's fight, flight, freeze, fawn, and then we kind of go through this, uh, these F words, I guess.
Yes.
But I kind of made this chart, and I think I sent it to you before.
Yeah, it's
Um,
brilliant.
and I've just noticed over time that I found six pretty predictable categorizable forms of dysregulation. And I found that pretty much everything fits into the six.
Mm-hmm.
And that's a little bit more complicated than just like, oh, just fight or flight, like, which is how we were maybe 10, 15 years ago. People
Yes.
were just like, yeah, it's just fight or flight. And freeze slowly crept in there. Now
Mm-hmm.
fawn is slowly creeping in there.
Mm-hmm.
But some people might not even know what these words mean. Um, I think the first place to start is knowing that our nervous system has, or nervous systems, I guess, to be more clear, has different expressions of what it does when we don't feel safe, when we feel that we have to be in some way trying to survive. So different survival modes.
Mm-hmm.
And I break it down to these six: stress, people pleasing, freeze, shutting down, panic, or dissociation.
Mm-hmm.
And those six things kind of cover a huge breadth of things in
Yes.
themselves. So most people, they know stress. So when they get stressed, they know what that symptomology feels like. They're pushing, they're tensing.
Mm.
When they're trying to do a task, they're trying to force through the task. They might even be irritable or frustrated. So then subtle stimulations in their sensory field, like noises, will seem louder. They'll,
Mm-hmm.
because their ventral vagal is being turned off. So the ear muscles are going to be relaxing. So they're going to be hearing background sounds louder, and
Mm.
it's going to feel invasive. And
Yes.
that's when people have little outbursts. They're more likely to get in arguments and conflict. And yeah, most people know that. But another one of the hidden forms of dysregulations, I believe, is people pleasing, or what is known as fawn,
Yes.
or this state of social reactivity.
Mm.
And basically, what it has people do when they're in a highly socially reactive state is, in very subtle ways, they're going to be modifying their behavior, their thoughts, and their expressions to avoid social conflict, to avoid possible abandonment or rejection.
Mm.
So that's when somebody's like, hey, like, do you like this band? And you're like, yeah, I totally love it. But you actually don't. But you're just saying it to be hyper
Yes.
agreeable. And those are the
Oh, I
subtle
know
ways
this
that,
one.
yeah, these are the subtle ways that, like, we do this. Like, everybody does it a little bit, right? And it's kind of normalized to a certain degree. But when your body is stuck like that, you actually can lose sense of what you actually want, what you actually
Yes.
need, who you actually are, because you're
Mm.
constantly modifying for the environment. So you lose sense of what your values are.
Mm. It's
So,
awful. It's
mhm,
such a suppression of your sense of self and a denial of your needs and who you are. And it also can be in the nicest of relationships that you're like that. So I was like that with my husband for years and years, just this subtle people pleasing things. So things like, we talk about where we're going, where we're going on a date, or what we're going to watch at the cinema. And I realized I haven't actually made a choice about what I want to watch at the cinema for like 15 years. And then I was like, right, hold on a minute. What do I want to watch? And then it was this feeling of being like lost a bit, like, who am I? What's my identity? What are my likes and dislikes? And is it acceptable that I like this thing when it's not been safe to be different? It's not been safe to express my authenticity in the past.
it is interesting. I also have a nickname for this state, and this kind of, I can see how this might make people a little upset, but I literally call it inauthenticity because
Mm,
that describes it pretty well. Um, it's it's this state, right, where you're looking for social harmony and connection so much that you're
mm,
willing to compromise your authenticity. But
yes.
what does that do? It actually blocks you from making a genuine connection at a deeper level. Like, you can have the superficial connections, but you can never really go deeper until you're like actually sharing your authentic expressions, because you're only connecting at like a surface mask kind of, I'm just going
Yes.
to present myself this way level.
And it's that underlying fear of I'm not going to be loved. It's
Yeah.
that massive fear of rejection. I'm going to be abandoned.
Yeah, I break it down: rejection, abandonment, and conflict. And the
Mm.
conflict is usually that could lead to the rejection. So there's this kind of fear around all of
Mm.
those things.
Hmm.
You could think of the most extreme form if somebody was kidnapped. Like, this would be an exaggerated example, right? Like, let's say you're kidnapped and your captor would have these outbursts
Hmm.
and they would become violent. Well, you could see how you would notice when you talk about certain topics, they would start to get emotionally roused up. So you're like, okay, I'm not going to talk about that. And then you could
Yes.
see if you're starting to express yourself and you're like sharing something authentic, and then they start retaliating. You're like, okay, I won't do that. And then you
Mm.
start modifying everything, and it becomes so internalized that when people can like get away from living with a captor, you know what I mean? Like, they become saved. They're no longer kidnapped. Then all of a sudden they're like, oh, okay, don't say this, don't, and their body has internalized this
Yes.
suppression of their needs, their thoughts, their emotions, their desires.
Mm.
And that would be an exaggerated example, but people do this in subtle ways all the time, through pleasantries,
Mm.
through just trying to make things smoothen out. But we don't exist in our most thriving state like that. And the
Yes.
reason I think it's so sneaky is because this kind of, in a way, seems like the normal way to be. Like, people
Mm.
don't have that many reference points. And a lot of people, when they think of like you just being authentic, they're like, they think of it as like almost like selfish. Like, you're just
Yes.
saying things, you don't care what people think. Like, you can't be like that.
Mm.
But in fact, by staying in people pleasing, even in, subtle ways, and we're all trying to clear this stuff now. So no big deal if you still deal with it, because we all kind of do to a certain degree. But staying there is actually aging you faster. It's
Mm.
actually putting a subtle strain on the cortisol system of the body. It's reducing your capacity to be yourself
Mm.
and to experience more flow state, more joy. It's like it's it's toxic, to do
Yeah,
that all the
it
time.
is.
And if other people are really, really regulated, and or if other people are regulated and you're always coming with a people pleasing kind of tone, it can be it can feel like you're bringing this tone into the room where they're like, man, I just want to be authentic and connect with you, but they like can't. So it's like it's
Yes.
blocking the flow of social energy amongst others as well. We still got four others. These first two are implicating the sympathetic nervous system, so they bring an overactivation of energy into the body. And
Mm-hmm.
so when people are people pleasing, they're often going to be talking faster. They're going to have that, we talked about it before, that up inflection where everything they're expressing is coming through as if it sounds like a question.
Yes.
Kind of, I just kind of did it a little bit there. But
Yeah.
so it's like, yeah, I think I want to go here. And like everything is like uncertain because it's
Yes.
looking to build rapport, right? You're
Mm.
constantly
It's
looking to build
looking,
rapport.
yeah, and that validation, like, is that okay? Is that all right? Is
Mhm.
that acceptable?
Yes. And truly looking to not be rejected through the tonality of voice. I've seen that most people in this state will get, muscle tension, pressure in the head usually. And I think generally, if you're to think of it on an energetic level, it's like people are out of the rest of their body and they go up into their head to think of how they have to edit what they're going to say.
Yes.
And
Yeah.
so there's a lot of just energy moving into the head where
Mm.
people are like, okay, yeah, what do I do? What do I think? What do I say? And they don't know what they actually wanted to say because they've left the rest of their body and they're going into edit my expressions mode. But let's switch to the dorsal vagus, which is to people who know polyvagal theory, this type of nervous system expresses different types of dysregulation that reduce energy in the system. I think of it as a suppressant.
Mm-hmm.
You could almost think of these systems as like they all have different side effects, the same way that if you took a drug, they would have side effects on your body. These survival strategies that our nervous system has, they can help us massively, like surviving, being kidnapped in that example, or fighting and flighting and literally like, fighting off an animal in the first example.
Mm-hmm.
Here, the suppressant effects start to reduce our capacity to connect socially. And this is where you see people self isolating, avoiding, and starting
Yes.
to move into the depressive states, where over time, through this dorsal vagus influence, you have what's this freeze state. And freeze, I believe, is like the first step in the dorsal vagus turning on. And the way that I look at the freeze, and I might not be factually correct, but it seems to fit this pretty well, is that the freeze starts to turn on the dorsal vagus, but the sympathetic nervous system hasn't quite turned off. So
Mm-hmm.
there's this push pull between the two in a way. Also, on the one hand, you're feeling like, I feel like I don't have the energy to go do this. But then on the other hand, you have this pushing force of the sympathetic saying, but I really should. I should go
Mm-hmm.
do that. So there's this judgment on the self for like feeling blocked, feeling like I can't do it. And
Yeah.
then there's this push to try and do it and like I should be doing this. So a
Mm.
good example could be like you want to start this new habit of going to the gym, yet you find yourself scrolling. You find yourself wanting to change your diet, yet you find yourself going and just putting the same food in your grocery cart
Mm-hmm.
and you're like,
Why am I
or
doing it again?
yeah,
Mm.
or you find yourself being like, okay, I have lots of things that I want to do, and then all of a sudden you're just on Netflix and you're just like watching something. And the state of freeze is a state that I think breeds addiction because it's
Mm.
actually quite uncomfortable state to be in, whether you're in it a little bit or a lot. It's putting the strain on the nervous system and it's activating both survival circuits in my theorization of it. Um, and I think that's accurate. The sympathetics putting the strain, the dorsal vagus is suppressing, and then you have this sort of push pull, and you have this numbness from the dorsal that's not really, you can't even really truly feel that you're stressed. You can't really
Yes.
feel the muscle tension. It's kind
Hmm.
of like just a vague sense of like, yeah, I feel constricted, I feel blocked, but I can't really
Yeah.
feel it
Or
because there's
just
that
like a
numbness.
flat, like
Hmm.
just a flatness of, I don't really feel anything.
Yeah,
Yeah.
there can be this emotional numbing. Uh, there can be this emotional suppression.
Mm.
So the dorsal, basically, this nervous system of the dorsal vagus is starting to suppress energy flow in the body. Therefore,
Mm.
like emotion flow and self-expression flow. So when you're frozen, if you get frozen, like when you go to do a public speech, you're like, I don't know what to say.
Mm-hmm.
And almost always with freeze, I believe, comes self-judgment, right?
Yes.
It's pretty
Yes.
it's pretty hand in hand with self-criticism. So if you could think of the
Mm.
person in that example, they're like, I don't know what to say. And they're at the same time, they're almost having like a self-judgment attack.
Yeah.
Like, oh my God, this is so bad. I look so bad. Everybody's looking at me. And
Mm-hmm.
then that energy is freezing that person's authentic expression.
Yes. I see it a lot with clients, some clients actually, where it's this space of like, I can't move, but I know I need to move.
Mhm.
You know, in life, I need to move. Why can't I just do this thing? But I can't. And I just feel stuck. And then this whole wave of like self-criticism then comes in, like, why can everybody else do this thing and I can't? And just that loop then exacerbates everything as well, you know? But it's something so much deeper than that, isn't it? In terms of um that freeze response.
You said a really good word, which I think captures it, is the word stuck.
Mm,
Usually, when I hear the word stuck, I get a pretty good indication that it's a likely freeze. Like if somebody's saying stuck and they keep repeating that, my
yes.
brain is going, that's probably freeze or something like
Mm.
that. At the end of the day, it doesn't really matter exactly which subtype of dysregulation somebody's experiencing. They all respond a little differently, but I have a same sort of approach for
Mhm.
noticing and developing mindfulness around all of them. So we'll get to that in a little bit, but
Yeah,
let's
and
go
there
through the rest if you're
and I
open
mean
to
there
it.
can be the flip as well, can't there, where you're going into that space of like, you know, like being in a really heightened state or running around like doing, yeah, just kind of hyper, and then
Overactive.
yeah,
Yeah.
overactive, and then flipping to I don't want to do anything.
Burnout. Yeah.
Yeah. Um,
Totally.
mm,
So it's going to change over time. And so developing a core mindfulness that encompasses all of the states and you where you can really get in touch with like what am I feeling? How's my nervous system doing?
mm,
Uh is just generally very, very helpful.
yeah.
Um, so I guess when you crank that freeze state and it really feels like you're pushing, you're trying to change, like you said, this habit, somebody's trying to start a new habit, but they're feeling stuck. If you crank that free state to the next level where you start to get the dorsal taking over the system,
Mm-hmm.
then what you start to get is shutdown, which is basically synonymous in a way with like the symptoms of depression. So the shutdown state is now the dorsal is taking over, the sympathetic starting to kind of turn off. So this person's feeling a lack of energy in the system
Yeah.
because the dorsal is shutting it all down. And in this moment, when somebody is in dorsal dominance like that, um, the system has become highly wired not for social engagement.
Mm-hmm.
So their eye contact is going to be extremely minimal. They're usually going to be looking down or away.
Mm-hmm.
Um, they're not going to be truly able to listen as
Yes.
well. If you notice, if you've ever worked with people who are like very depressed, it's
Mm-hmm.
like you could say something, they're like, yeah, I don't know.
Yeah.
It's like they can't hear it, they can't feel it.
Yes. Yeah.
Uh,
Or it sounds like they're bypassing what you're saying.
Yeah, it sounds like it
Yeah.
can sound like that.
Mm-hmm.
Like, but in that moment, they're generally not wired, right? Because the system is so numb
Yes.
in this semi-dissociative type state, right? That what you have is somebody who is listening, but they're not listening at the same time. They can hear
Yes.
you, but they can't hear
Yeah.
you.
They're not
Uh,
actively there.
in
Yeah.
yeah, they're
Actively
not
present.
really, they can't, they're not, well, they're not in the social engagement nervous system, and
Hmm.
that's what we need, is this ventral circuit, which I guess we'll talk about in a second. So this the system shutting down, and usually there's self-isolation, there's avoidance, there's high levels of procrastination. If you
Mm.
thought you were procrastinating in freeze state, crank the dorsal up, and yeah, your kitchen's gonna be, no dishes are done, you know what I mean, like
Yeah.
everything's, you're not, laundry's not going to be done, self-care is not going to be done,
Mm.
uh like your just general things you think you would need to do, like certain small hygiene things, that's going to get cranked off because the energy is so suppressed
Yes.
and low in the system that it just feels like everything feels so overwhelming to even
Mm.
start.
Mm.
But then I talk about these two other states, right? And these are less spoken about, but I believe that they'll probably be more spoken about into the future. And I believe that these are distinct from what we've talked about so far: the sympathetic, which has the kind of fight, flight, and the stress state,
Mhm.
and the people pleasing, and the dorsal, which has this freeze, and then the shutdown, which really takes us out of social engagement even further. Um, that beyond that, especially people who experience like really intense overwhelm, can go into panic. And what I've observed is that panic, and subsequent obsessive or very distinct types of anxiety, like health anxiety specifically, where people are highly reactive to internal sensations in their body and always checking to see if
Mm.
they feel different or if they feel sick or what's going on, and they're kind of having this little freak out, that this panic is distinct from the other states. And so I categorize it like that just to help make it so. um, so one of the things I've seen is very predictable about panic or panic attacks is that people usually think or are compelled that they're having a medical emergency or are dying.
Yes.
Yes, almost every time, right?
Yeah.
So my mother had a panic attack. I've had dozens, so I'm chill with it now. But when I first had it, like I'm like, oh, I'm dying. Like you
Yeah.
think you have to like go to the hospital.
Mm.
And when my mother had a panic attack, she thought she was having a heart attack.
Yes.
And
Yeah.
I thought that was very interesting. I've heard of other people having a panic attack and they thought they were having a stroke.
Mm.
So what's interesting is that this type of dysregulation is flooding of energy, of
Mm.
overactivation in the system that's very disorienting.
Mm.
And it's slightly dissociative, and it has people obsessing about what's going on in my body, what's going on in my body. And then it can lead them to feel compelled that they're having some sort of a medical emergency.
Yes.
And it's
My
very predictable like that.
Yeah. My husband has been through waves of like, quite significant anxiety and panic attacks and so on. And one of the signs that he knows now that he's kind of going into that space is he says that his arm hurts.
Interesting. Like
Yeah,
he'll
and
get a he'll
it's
get a physical symptom.
yes,
Mm-hmm.
he gets this physical symptom in his arm and he'll be talking about it for like, he'll keep saying, I've still got that pain in my arm. And it's so clear to me that he knows now as well that like he's in that in a dysregulated kind of
Mm-hmm.
space. And the other thing he says is heart as well. So when he
Mm-hmm.
first had one, he went to the hospital thinking he was having a heart attack. And
Exactly.
as the observer as well, I was kind of like, okay, I don't know what this is. I don't know if this is a panic attack or is it a heart attack, like, you know. And my mum as well, she was having high blood pressure. So
Mm-hmm.
yeah, experiencing these kind of waves of feeling like again she was having a heart attack.
Yeah.
And and in terms of understanding that, it's taken a really long time
I mean,
to
that's the thing.
distinguish
These
between what is it high blood pressure, is it what is it panic and stress, or is it a medical issue? So it's difficult, isn't it, to distinguish, and it must be really frightening. I've not really experienced that myself. So
Yeah, it's a very, very interesting state, and it can completely compel you that you're having this medical emergency now.
mm,
And the way that I think it is so compelling is that the sensation change is so compelling. So the sensations that you experience in the body just flood in and change.
mm-hmm.
And then a lot of people, when their sensations change, they're like, oh, that means something's happening. Like,
Yes.
and there's this abrupt change of sensations. But there's also there's two things about this state that I believe are um and it's interesting that you mentioned your husband having like body change, like feelings like, oh,
Yeah.
my heart feels different, my arm feels different, stuff like that.
Mm.
um I consider this state semi dissociative and semi obsessive. So
Mm.
there's like this obsession of focusing and fixating
Yes.
all the internal energy on like what's happening inside, what's happening. And then
Mm.
there's this reactions to the sensations that are very, very intense.
Mm.
Right? Like you're having, it's one thing to be afraid of things on the outside. It's another thing to be like, oh, something on the inside I'm like
Yes.
terrified of.
Mm.
And
Mm.
it can just cause this different type of reaction. And so there's that obsessiveness of focusing on the internal and fixating on internal body changes. I see this almost every time, especially
Mm.
people who have long-term health anxiety, focused on their body and their body
Mm.
changes. And they're like, oh, my neck feels different. Oh, my head, like, oh,
Yeah.
something must be wrong. Like, so one of my clients, she had a thing where like her, when she would feel it in her neck, she was like, "Oh, I'm gonna have a panic attack." Like, I just know it. My neck is up. My neck is off. Like there's something
Yeah.
going on. I also consider it semi-dissociative, which I just touched on, and I think that that element, what happens like when we start to become dissociative, is we don't feel our body quite the same way. We feel it like a little bit at a distance, and it's a little bit more vague and ambiguous. And I believe it's more possible to experience somatic distortions or hallucinations from that state, where you're like, I
Mm.
feel like I'm having a fever, and then and I've had this before, and then I check my temperature and I'm not, and I'm
Mm.
actually just I've just
Yes.
completely felt my body temperature different because I'm
Mm.
slightly dissociated from my body, and I'm like, I could swear I felt like I'm having a fever,
Mm.
and I check and I am completely
Mm.
fine.
It's interesting because it sounds like it's such a present thing that you're actually being really present with your body, but it's actually another way of disconnecting from self, isn't it? I mean, I guess the
Mm-hmm.
way that I see it is a disconnection from what is out of alignment in your life. You
Mm,
know, this I always think with all of these things that they're all indicators that something is out of alignment to your truth around
mm,
who you are and how you're living. And so it's just that there's different degrees and responses to essentially the same thing, which is that there's some disconnection and misalignment.
mm. Yeah, and then the dial just gets cranked up more and
Yes.
more and more through these different expressions. Like as we've gone down the chain here, they
Mm.
seem to just get more harder to ignore. I
Yes.
guess would be a good way
Yeah.
to put it. Um, yeah, so I've seen that in panic in general. If people experience panic in any kind of long-term way, because most people just have it like in a panic attack, but when people experience it in a long-term way, they'll have like health anxiety. So they'll usually
Mm-hmm.
be fixating and focusing on their health. What's wrong with their body? What can I do to like, try and not have my body do this panic attack again? And that can become a cycle, and people will obsess over their health in a way,
Yes.
that's not healthy. Funny enough.
Mm-hmm.
Um, and then lastly, if the system gets too overwhelmed, too stimulated, and I don't know this for a fact, but I think a lot of what can happen is this overexcitation, and it might perhaps involve glutamate, which is the excitatory neurotransmitter. And when their overexcitation starts to get too much, the system can get dissociated, which is like,
Mm-hmm.
okay, this is way too overwhelming. Let's create a distance. And
Mm-hmm.
then there can be this kind of split between the mind and the body, this distancing between one's thoughts, between one and one's emotions, this
Mm-hmm.
distancing between one and their experience of their body. And for some people, it can even, this distance where they feel like reality is farther away, like they feel
Mm.
distant from their humanness, they feel distant from reality, all their perceptions, and you feel, like kind of far away in that sunken place.
Yes.
And this would be like on my spectrum, the sixth color, which
Mm-hmm.
I call purple. And yeah, you can have all different types of symptoms here that seem very strange, very bizarre. Reality can start to seem like is strange to you, like
Mm.
things that you were familiar with. All of a sudden, you're like, everything feels like unfamiliar. I feel
Yes.
distant and bizarre, or maybe
Mm.
floaty, and the body can go into somatic dysphoria, where people just like, my body just doesn't feel good, so I'm numb from it.
Mm.
I can't even go there. And you can see this when people have intense PTSD, perhaps something really overwhelming happened, and then the body just makes that
Yes. And
split,
it's,
so can't
I,
feel.
yeah, I guess this is where there's like higher risk of self-harm, eating disorders, because you're so detached from
Mhm.
um, your feelings, you know?
Yeah, in this space, it's really hard to feel anything for sure.
Mm. Mm-hmm.
Um, or if you do, you're going to feel things, but they're going to feel far away. It's kind of a very strange.
Yes.
But what I
Yeah.
find interesting about these dissociative states is it doesn't always, but sometimes it can couple with people having like existential sort of obsessive thoughts, or obsessive thoughts trying to figure out like, what is even going on with me, what is going on. And this is where you can kind of get some of the depersonalization or derealization type experiences that people have, where they're just thinking about like, things don't even feel real. Is reality real? Is
Mm.
this real? What's real? Blah, blah, blah. And they're just cycling on these types of thoughts. And that actually kind of, in some ways, goes hand in hand with this dissociative state.
Mm-hmm.
Um, and so basically, now that we've gone through the full chart, and now we actually get to go to the good stuff, which is the ventral
Mm.
vagus, which is a great place to end in terms of the spectrum. That every state has a story. It has a sort of a modus operandi. It has a way of thinking, a
Mm-hmm.
way of telling yourself the story about what's happening. And I think it's important to become mindful of those stories so that we can, label and let go in time of rehearsing them over and over again in our mind.
Yes. Yeah.
And as we do so, our body can go more into ventral vagus, which I just call ease and flow and bliss and
Mm-hmm.
contentment and safety, playfulness and intimacy, and all the beautiful experiences of just energy and emotion moving through our body, where we can really channel our authentic self in a sustainable way. In the ease and the flow and the bliss, the ventral vagus has us wired for social engagement. So we feel that we can truly hear other people. We have the capacity to listen, to
Mm.
hold space, to empathize. We have the capacity to share emotions and to feel safe in emotions, even if
Yeah.
they're like sadness, even if it's whatever. Our body feels like, hey, it's okay to be sad. Like, I can be sad. It's no problem. It's
Mm-hmm.
not like, even though it is vulnerable in a way, it's not like I'm not experiencing it as something that's unsafe.
Yes.
I'm okay with it.
So, from your perspective, what are the, like, if you could maybe share, let's say, five core elements or five things that support healing
Yes.
to help us to move to that ease and flow ventral state.
I think number one is something that this is where you would start, especially if you're just new to all of this.
Hmm.
Um, and I call it something simple. I just call it resources. Like,
Yeah.
if you have resources, things that reliably have triggered you feeling maybe at least a bit more safe, if not like
Mm.
way more safe in your body, that'd be where you want to start. Because for some people, their whole life is like ping pong balling around, and
Yes.
it's like I don't have even a safe environment, right?
Mm.
So resources would be like just writing down or discovering like, what are like the top 5 to 10 people or places or even activities that make you feel content, safe.
Yes.
like more relaxed than everything else. And for
Which
some
might
people,
feel like
it's
a challenge. Yeah.
yeah. For yeah, I've done this exercise with some people and they are like, I don't have any. I'm
Mm-hmm.
like, well, that's the problem. We need to figure this out.
Yes.
Because if you
Yeah.
don't have anywhere where you feel safe, then like how do we even start? We
Mm.
need to have some kind of a safe space, some type of a
Mm.
safe relationship or a safer feeling relationship. So then I'll like ask them, okay, out of your top 5 relationships, top 10 relationships, who feels the more safer? I'm not saying they
Yeah.
feel safe, but like who's on the spectrum, like slightly safer feeling,
Mm.
like you could be yourself around them a bit more. And then we start getting somewhere. Be like, well, I definitely don't feel safe with my dad. I'm okay. That's
Mm-hmm.
okay. But like with my cousin, I feel like a little bit more safe. Okay, good. I'm gonna write that down.
Yes.
So resources, I think, is a place to just start. It helps you learn about your nervous system. Who are the people? What are the places? What are the activities that make your body that just help reliably bring about a little bit more safety?
Mm.
And sometimes people, they've never thought of that. They're
Mm.
like, well, I don't feel safe at work. I don't feel safe at home because my like partner's like abusive or just we're always arguing. I don't feel safe here. I don't feel, I'm like, okay, well, now we know where you don't feel safe. But I'm like, when's the last time you felt a little bit? And they're like, well, I went to the spa or something like that. I'm like,
Yes.
okay, we found something here. They're like, and they're like, you know what? I feel a little bit more safe when I'm driving in my car. It's like I'm in
Yes.
my space, I'm in my thing. So that's where I like to start people off is like, what are the activities? Who are the people? What are the places where you could just say there's a subtle difference, you feel a bit more safe?
Mm.
That's usually where you can set a foundation.
Yes. I agree definitely with, yeah, everything that you've said. And
Mm-hmm.
also just that thing as well of like, okay, if you're on your own and you're feeling really triggered, or you're trying to, I guess, create a bit of a baseline for your day, how do you find that connection with an object or the ground or with your hand on your heart or whatever it is that makes that builds that connection with a sense of safety if that's not
Mm-hmm.
there yet?
Yeah. So I think that's the first place to begin. Like if I ever work with somebody who's just really overwhelmed and scattered, we kind of want to start there.
Mm.
Um, but beyond that, one of the next spaces that I like immediately go to, and sometimes I start here, but if I need to start with resources, sometimes we start there, but is the mindful brain. And the reason for this is I just want to put this in context. So I think that any one of these states that we've covered, these dysregulation subtypes, can be what I call unblended from, which is like it's in the driver's seat, and unblending is it goes in the passenger seat, it goes into
Mm.
the back seat, and then it's no longer needed in the vehicle,
I love that.
right? Yeah. When
Yeah.
it's in the driver's seat, you know what I mean? You're living out your fears. The fear is motivating your action. Like, oh my God, I'm gonna be abandoned, right? In people
Mm.
pleasing. So
Mm-hmm.
I've got to do this. I have to do this. So that's that fear of abandonment in the driver's seat, and it's saying now you have to say everything nice to this person, do all these things for them, and like make them happy, and always be reacting to whether or not they're happy. That's the fear in the driver's seat.
Mm-hmm.
Then, as you unblend, the fear goes into the passenger seat. You're in the driver's seat, but it's still trying to, give you advice from the passenger seat. What is called secondhand driving or whatever, where somebody's like, they're trying to be like, no, no, turn
Yeah.
here, and you're like, no, no, we're going straight, and it's trying to drive, but it's there. You know what I mean? And then when it's in the back seat, it's a little bit calmer, but it's still there. And you can feel it. It's like trying to
Yeah.
influence how where it's like, can we go here? Can we go here? And you're like, no, we're going straight. And then if it's out of the vehicle, it's like, oh, you know what I mean? Like I'm going where I want to go.
Yeah.
And you're not so much influenced by the fears or these different
Mm-hmm.
types of dysregulation. So I believe that what part of the process to have this unblending is to activate the mindful brain.
Mm.
And I think of the mindful brain as like the pattern interrupter. Because usually when people go into these dysregulation subtypes, the mindful brain shuts off, and they
Yes.
just sort of snowball through
Mm.
the state. And it's very hard to self-reflect. For instance, in people pleasing, we've been talking about it a little bit, like fawn. People, like, you could ask them, what do you want? What do you need in your relationship? And they're like, I don't know.
Yes.
They don't know. Or if you ask
Mm.
somebody who's depressed, like, what would motivate you right now? And they're like, I don't know. Like,
Yeah.
there's the inner connection is to their inner knowing, to their inner intuition, and to, like, even self-reflection is kind of blocked or turned off, because the mindful brain, I believe, is a big piece. It's kind of, the blood flow's not going there, so it's not
Yes.
really as active, and they can't really see with clarity what is happening
Mm.
internally.
Hmm.
That's why it's so much easier to notice other people's shit and not see your own, because when you're
Yes.
in it, it's like the mindful brain's not as online for you, so
Mm.
you can't really see what's going on with you.
Yeah.
But when it's somebody else, you're like, oh my God, like, they just need to do this. And you can just see it. They're like, but they don't see it.
Mm. It's like when, you've been really, really busy with work or whatever it is, maybe for weeks, and then you take some time off and you go out, you go hiking, or you get out in the sun or whatever it is, and you have that time off your phone, you you reconnect with yourself, and then you have this like inner wisdom of what you might need to drop, or what isn't making you happy, or whatever it is. And that I guess is an example, isn't it, of switching on the mindful brain, because in that time off you're present, and so there's that sense of spaciousness that's created, and then you can tap into that inner wisdom. Whereas when you're kind of in this space of like, right, I've got to do this, I've got to do that, and you're not tapping into that meditation, or you're not tapping into that space of clarity and heart,
Mhm.
it's just so easy to lose it. It's so easy to not be able to see a way out, you know. Yeah.
Yes. Yeah. Like, I think what you're mentioning, it sort of touches on resources, but it also touches on like
Mm-hmm.
mindful brain, in that, like,
Yes.
if you
Yeah.
give yourself the space, or sometimes the time,
Mm-hmm.
the places, like you said, like going on a hike or whatever, and then it's almost like you're creating room for that mindful or that clarity to come through.
Yes.
And uh that's also a really, really good place for, I think, a lot of people to start, is just like, start creating space for that.
Yeah.
When I talk about I guess, the more subtle areas of the mindful brain, activating that, like, I want to help people activate that when they're in the middle of the chaos.
Yes, exactly.
And that, I'm not saying that's easy. That's the hardest
Mm.
thing, in a way. It's like, okay, your roommate's yelling at you, everything's happening right now. Can you become mindful right
Mm.
now?
Mm-hmm.
And the way that I do it is I just try and train people on mindful labeling.
Mm-hmm.
And the idea is non-judgmental observation of your state. And what I
Yes.
get them to do is just to name the state. And if they want to, they can take a deep breath. And one of the things that I get people to do, and I've gotten really good feedback on it, is I get them to just raise one finger. You don't have to, you could do it, like, you could just, like, lift your finger a little bit like this.
Mm-hmm.
But if you're alone, sometimes you could be like this. So, like, you're
Mm-hmm.
spiraling, you're in your room, you're like self-criticizing yourself. You're like, why can't I do this? I'm so, like, blocked on it. And then if the person who I've, like, been working with remembers, and they're like, oh, this is freeze. Yeah, this is
Mm-hmm.
freeze. And that's it. That's all I get them to do, is just to label the state, and just to take a moment, like, is this freeze? And they can check their body sensations, check the
Yes.
type of, yeah, I'm being very self-critical. Yeah, this pretty much lines up with freeze right now. Okay,
Mm-hmm.
freeze. And just that is like, it's almost like you're in this room of just noxious fumes and gas, and all of a sudden you just open the window, and it's like,
Yeah.
oh, there's a little
Yes.
change, and you didn't have to do anything. All you did is just observe and label it, so you could just notice what even really is happening right now.
Then you're watching it, you're looking
Yeah.
down on it rather than being in it. Because you've got the
Yes.
separation. Yeah. Mm-hmm.
So that's the mindful labeling exercise. And there's other exercises I do that like we go, because that's kind of like just doing it on the fly. There's other
Mm-hmm.
ones that will help you go deeper, where you're like, more meditative in a way. Like you're tuning in your
Yes.
sensations, you're tuning into the beliefs. What's the story? You can go all the way there. But just
Mm-hmm.
starting, I think it's because I still do this like all the time.
Yeah.
Like if I notice, I think this would be a good story. So if I've noticed that I'm like, oh, I'm starting to have that like panic attack feeling. And then I'll be like, yeah, that's panic. Or
Mm-hmm.
I'll call them the colors that I have in this map, this chart,
Okay.
right?
Yeah.
So I'll just be like, oh, pink. And
Mm-hmm.
that takes a lot of judgment out of it too. Because if you're just
Mm.
calling it a color, it's not like color's not good or bad. It's just a color. So like, oh, that's
Yes.
pink. And then you're like, okay. And that's it. You don't try and change it. You don't try and do anything. And
Mm.
through this just labeling, not only me, but some of the people I know who've dealt with panic attacks, they've told me they've been able to abort effectively panic attacks like
Mm-hmm.
multiple times, just being like, oh, that's a panic. That's panic. Those are the sensation panic. Okay.
Mm-hmm.
You don't have to fix it. You don't have to change it. You're like, and it helps you kind of opt out or abort because
Yes.
you're like,
Yeah. Yeah.
oh, that's just panic. Like, I don't have to
Mm.
believe that I'm actually dying right now, that I need to go to the hospital. Oh,
Yes.
you know what
Yeah.
I mean? This big like relief can happen.
Mm-hmm.
So that's how powerful the mindful brain is. It's the pattern interrupter. It's the cycle breaker.
Mm.
It's the crack in the door to more ease and flow and bliss. And
Mm.
without the mindful brain, I don't think long-term change truly happens. You need to have, I mean, that's why therapy and different things which help bring that up are going to be so effective in the long-term change, because they're going to be able to see and reflect and no longer identify, no longer have that part of them in the driver's seat,
Mm-hmm.
slowly unblending, be like, oh no, I don't, that's that again. Okay, then it goes to the passenger seat. So we went to the mindful brain. And I think the next piece, and you mentioned this a little bit just a few minutes ago, is the coherent heart.
Mm.
So heart has these electromagnetic signals that are sent out omnidirectionally from it. That's because it's the electromagnetic epicenter in the body. It has this just big electromagnetic influence.
Mm-hmm.
And when our heart's fields that come off of it are scattered, chaotic, disorganized, that affects the resting charge of all of our cells in a certain way.
Mm-hmm.
And when our heart's fields and the wavelengths that come off of it, the pulsations, those fields are coherent and organized and
Mm-hmm.
harmonic and ordered, then that affects in a positive way the resting charge potential of all the cells in our body.
Mm-hmm.
And HeartMath is this institution that I've kind of taken some courses with and gotten certified with. And they basically correlate this coherence with um, a nervous system measure called HRV, heart rate variability.
Mm-hmm.
You can kind of measure coherence to a certain degree with heart rate variability, or HRV. And there's cool technologies, like I actually have one right here, where you
Oh,
you know you
cool.
you plug this thing to your ear, and it's
Mm-hmm.
going to be measuring the variability of your heart rate. And you can do breathing exercises and you can do heart focused exercises that will
Mm-hmm.
essentially help you to increase your coherence. And coherence, I think, is so foundational to regulation,
Mm-hmm.
because the heart sends up 9 times more signals to the brain through the vagus nerve than the brain does down to the heart. So a lot of how we can access regulation is the bottom up, or the body
Mm.
first method
Yes.
stuff. And
Mm.
I know, there's this huge wave in like therapy and stuff now, like somatic or just embodiment practices and things like that.
Mm.
And I think the heart is a really deep vehicle for some of those, and for what I believe are like some of the most powerful ones.
Mm.
So helping get people in touch with their heart, or with heart coherence, or just practicing it yourself, I think is one of the best vehicles for accessing more regulation. Because a lot of the things that you're going to be thinking about when you're dysregulated, there's actually no solution to them.
Mm-hmm.
For example, if you're just like, I'm not good enough, how do I make myself good enough? When actually the truth is, you are whole, you are complete,
Yeah.
there, you are good enough.
Mm.
You can't solve a lie. you can't solve something that's not true. Like if you start trying to solve a problem that's not truly what the problem is,
Mm.
then you're never really going to get to a solution because there is no solution. It's a circular loop.
Yes.
It's just a cycle. Like feeling shame is a cycle. And
Mm.
I noticed that when I had a life coach, like, and I was trying to go into shame and understand where that was for me. It's like this part of me is like just felt bad, felt
Mm.
pathetic, felt embarrassed. And I felt
Mm.
embarrassed that I was embarrassed. And I
Yeah.
felt bad that I felt bad. I felt pathetic about how pathetic I felt. And it was just a loop. There was no like, like solution to it. It was
Yes.
just, this is just a complete circle.
Mm.
So a lot of what I believe the way out of these kind of mental loops is by dropping out of the head and coming into your
Mm.
heart. It's a different space. That's like the quantum leap. That's the paradigm shift in a way,
Yes.
is out of the head, coming
Yeah.
into your body and coming
Mm.
into your heart. And so I'll do these simple exercises where you just focus on bringing your attention slowly down from your head into your heart. And you
Mm.
breathe in and out, imagining the air is going through your heart and out through your heart. And just doing that for a few minutes, it's
Mm.
wild,
Yes.
how you can be like, just a few minutes later, you're like, whoa, I was trying to figure out like all this stuff.
Yeah.
I haven't
Right.
figured out any of it, but I feel
Yeah.
way better. And I don't feel like I
Yes.
have to figure anything out anymore. I just
Yeah.
feel connected.
Yeah, definitely. And the safety, that's a place of safety, isn't it? If you can
Mhm.
find ways to connect with your heart, there's so much truth and wisdom, in that space.
Yeah, so that I think is one of the spaces to go. And to
Mm.
the last one I would touch on, and we don't have to go as deep with it, is just social engagement or the ventral vagus nerve. So like when you
Mm.
have healthy relationships, safe feeling relationships, your body is just much more wired for regulation. When you feel like you can
Yes.
express yourself around people and you don't have to like modify or change it or like
Hmm.
feel self judgment, yeah, that's going to change the system, the
Yeah.
body, the nervous system so much too.
I think the important one with the last one is distinguishing between, yeah, that it's obviously so much more helpful if it's authentic relationships, authentic, safe relationships, which enable you to feel safe, for your body to feel safe, right? That you could
Hmm.
be in lots of different relationships, but they don't feel safe. In that situation, is it better to keep the dysregulated relationships?
I have a kind of process that makes sense to me. So it's like, imagine you have 10 relationships and you're focusing most of your energy on like the three most toxic ones.
Yes.
Somehow, some way, you just ended up like, I've got to fix this. I got to find harmony
Mm.
between this person. You keep trying, but like it's staying unhealthy.
Mm-hmm.
And what I say is, you don't have to like abandon it and have a full boundary. I mean, sometimes you do, but you don't have to do that. What you can just start doing is shifting more energy into the healthy ones, and just bit by bit shift more energy into the healthy relationships. So
Yes.
there's never really an abrupt change. And then now you start to have your energy focused on your three most nurturing and nourishing relationships,
Mm-hmm.
and you're focusing way less time and energy
Yes.
on the
Yeah.
unhealthy ones. And you
Mm.
didn't do it by just being like, okay, this is done, focusing here.
Yeah, because
Because,
there's a lot of messaging around that as
yeah,
well on social media, isn't there? Around like just cut off the toxic relationships. And you can approach things in a much gentler way on your body,
mm,
because that like, just sudden like decision of, all right, I'm not,
we're done.
you're toxic, we're done, right? And whether you can handle that, do you know what I mean? Whether that feels,
For everybody involved, that can be
yeah,
very abrupt.
exactly, yes. So that, yeah, it's you can do things in a way that feels more regulated in the process, that's going to trigger
Hmm.
stuff, isn't it? But that feels, like you said, like a process rather than um harmful.
Yeah, I'm even thinking about if you were to do that and be like, okay, I'm not talking to any of these people anymore. I'm going to put all my energy focusing on these new people. Like, everybody involved. That's abrupt for you. That's abrupt for the people who you just cut off. And
Mhm.
it's also abrupt for the new people they're not habituated to you putting all this energy into those relationships either. So they might be like, whoa, this is a lot. Like, whereas if you make a gradual transition of slowly being like, you know what, there's putting a little bit too much energy here, you start to nurture these other relationships, you build them, then over
Yes.
time it's going to feel natural. They're like, oh yeah, we've been building these connections. It
Yeah.
makes sense. You've strengthened that. But if you do
Mm.
that cut approach and then you try and put all this energy into other places, and then people are like, I don't know, I'm busy, like they have
Yeah.
other life stuff, now you're alone. And what happens
Yes.
when you're alone and you feel isolated is
Mm.
you might spiral,
Mm.
or you
Or
might
you
go
go
back.
back. Yeah.
You go back.
Mm. Mm-hmm. Yeah, I think it's so important to, yeah, that was so important to talk about that actually, wasn't it?
Mm-hmm.
Wow, just so much. There's so much in this episode. I feel like we need to listen to it twice at least to, yeah, to kind of integrate it and apply everything that you've said. And I can really connect with the approaches that you use as well in supporting that healing. And yeah, just you've kind of described it so well in a really accessible way. So thank you so much, because that is something that I want to create, that there's conversations around things like neuroplasticity and regulation, but that it is in an accessible way, because it can feel intimidating. I mean, for me, I said this before we got on the onto this live, that that it can feel a bit intimidating, the knowledge side of things, and it's like, okay, where do you start with it, so it's so important that it's accessible to anybody, because we're all operating in this with the same systems.
Mm-hmm. Totally. Thank you so much for holding the space to have this conversation. And it can feel overwhelming, like even just listening to this episode. But a lot of these things are very intuitive. That's what I've kind of
Yes.
seen. A lot of people they might not know anything I just talked about, but they might in a way, they kind of have already known these things. Like
Mm.
they know that, like, oh yeah, when I connect with my heart, that really helps. Or like
Yeah.
when I'm observing myself, or like when I go to my safe places, safe people, or when I have social connection that's healthy, I feel good. Like they're very intuitive things to know. And
Yes.
I
Yeah.
think the big takeaway that I will always want to leave people with is around neuroplasticity,
Mm-hmm.
just like our permission slip to change. Like we can, wherever you are, whatever you're stuck with, whether you related to these different subtypes of dysregulations that I spoke about a little bit or a lot, the nervous system can rewire over time through new
Yeah.
experiences, especially through mindfulness.
Mm-hmm.
And like I said, that analogy of the person's going from the front seat to
Mm.
the back seat, and then you can have the experience where this is no longer a thing that's in your life or running you, running you to the ground, or
Mm.
however it is happening. And I just need to put that hope out there for people, because I
Yes.
think that's an important
Absolutely.
just ethos and
Mm.
principle to have. Because if you
Yes.
don't believe there's any way out, then that's pretty depressing. But
Mm.
our approach with this new knowledge of neuroplasticity, like our nervous system can be rewired, our brain
Yes.
can be rewired, and we can be in an entirely different experience of ourselves,
Mm.
sometimes faster than you could ever
Yes, I
imagine.
agree. You can be stuck in the same loops for years, and then you can, access the right support and what is right for you, and rewire, do certain things that can shift things in the space of like 6 months, and maybe 6 months for like, really
But
integrating, and yeah.
yeah,
But it's amazing. It's amazing if like people knew, where they could be in 8 weeks, 12 weeks, 6 months, a year. You'd do it, wouldn't you? If
you
you
wouldn't
knew
hold
what,
back.
yeah, you wouldn't hold back uh from what's possible, I guess.
Yeah, I truly have seen it and believed it. Like people who have been stuck in things that have seemed like they felt like there was no way out.
Mm,
And then they had over time a few of these big shifts, a few of
yeah.
these kind of little quantum leaps, and all of a sudden they're like, whoa, this thing isn't even a thing for me anymore.
Yes.
And
Yeah.
it was my main problem for like
Yeah.
so long, and it's just
Yes.
gone.
Yeah.
And like I have to constantly remind myself of that too. Like when I go through something, it's like, hey, this isn't permanent. Like, and also this recent discovery of neuroplasticity is our permission slip
Mm,
of the modern era to know that we aren't trapped.
yes.
And even if it takes long, subtle changes are possible. And that even reductions in intensity of symptoms is a win. Reduction in
Yes. Yeah.
intensity of overwhelm is a win. And
Mm.
like that's a good signpost along the path that change is occurring in the nervous system.
Thank you so much, Will, for all of your shares. So beautiful. And yeah, I'm sure that everybody is going to value from this episode so much. So thank you, thank you, thank you.
Appreciate it. Follow me on Instagram if you want to at will.deroode. And that's where you can stay connected with this type of info at will, WILL dot Deroode, DEROODE. The
So I'll
two.
put all of the details in the show notes and any details of anything that you're currently offering, promoting, that people could access as well.